Hi, my name's Sarah Tadros, and I'll be discussing infectious diseases in animals. In this video, we'll focus on a few diseases that are important to you, including the influenza virus, human immunodeficiency virus, and E. coli bacteria. Infectious diseases are caused from viruses, bacteria, fungi, or protozoa that can be transmitted between different species, including between humans and animals. The type of pathogen and biological makeup of the organism determines the symptoms and pathology of the disease. An epidemic is when a disease is present in a large amount of people around the same time. The first disease that we will be looking at is influenza. Last winter, over 80,000 Americans died from the flu. This is the largest amount in over a decade. 90% of mortalities were of people above 65 years old, but 180 victims were children and teenagers. The high death toll was unusual because it was due to a normal flu season, not a new pandemic strain of the virus. The flu vaccine's effectiveness varies each year, with last year having 40% effectiveness. Viruses mutate fast. Since each flu vaccine takes 6 months to become available, experts predict which strains they should make vaccines for earlier on. Therefore, the virus can mutate in an unexpected way, making the vaccine imperfect for the exact strain that is most prominent. Nevertheless, the National Foundation for Infectious Diseases strongly encourages everyone to get the vaccine. Even with inaccurate vaccines, they are helpful overall to prevent serious illness and death from the flu. The way that the virus can change so rapidly is in a process of an antigenic shift, when viruses of different species contact each other and switch genes. Intermediate hosts are those who can have strains from two different species. Pigs are intermediate hosts of the avian flu, or the flu with strains sourced from birds. Experts predict that the avian flu has the possibility to cause a pandemic or an epidemic worldwide. Here is an important video of Dr. Seymour from Sunnybrook Hospital summarizing the importance of people getting the influenza vaccine.
As you know, each and every year we get influenza season in the winter months, and we can certainly expect it's going to happen again this year. We know that on average, about 1 out of every 6 of us is likely to get infected with the influenza virus. Those of us who are older or who have other underlying disease are at higher risk of more severe complications. So true influenza is respiratory. So someone who's got true influenza, they have a sudden onset of fever, chills, headaches, sore throat, a dry cough, often with aches and pains. Their muscles are really achy. It's a shot in the arm. On average, the vaccine is about 80 to 90% effective in young, otherwise healthy adults. It is a little less effective in older adults, and we're talking therefore maybe about 60 to 70% effective. That's not as good as we would like, but importantly, it protects older individuals who are at risk of serious complications from developing pneumonia or from needing a hospitalization related to influenza or of dying from influenza. So although it's not a perfect vaccine, it is a helpful vaccine and is protective.
In a group discussion, discuss some ways that you, as a Monmouth student, can protect yourself from getting sick. Another disease we'll look at is the human immunodeficiency virus, or HIV, and acquired immune deficiency syndrome, or AIDS. AIDS was originally diagnosed in America in 1981. In this molecular biological study, people approached learning more about HIV and AIDS through studying the viral RNA in archival specimens from patients. The HIV-1 genomes are helpful to understand more about the origin of the disease in Americans and how it should be treated today. Patient 0, a very sexually active gay man, was significant because he leaked a cluster of homosexual men who all had AIDS and strengthened evidence of the illness's ability to be transmitted sexually. An article written last year by the Washington Post criticized the impact of the Trump administration on the Presidential Advisory Council on HIV and AIDS. This followed when President Trump fired many of its members weeks after a few resigned in protest of the administration's opinions on certain health policies. The Presidential Advisory Council on HIV and AIDS has advised the U.S. government since 1995. The people fired were in a 4-year term effective of 2016, and they offered strategies to lower the incidence of HIV and AIDS, and they were not paid for their services. They include medical professionals, people of the industry, and people living with HIV. The Trump administration is criticized to have an incoherent plan to help the HIV and AIDS epidemic in America, and does not look for the experts' help in policy making. Their health policies, in turn, could have detrimental effects on people's lives who have this disease. The third disease that we will be talking about is E. coli. Pathogenic E. coli can cause infections such as urinary tract infections, or UTIs, meningitis, and septicemia. E. coli associated with meningitis in newborn children can cause severe neurological damage or even death. Reservoir hosts, or organisms who generally host pathogens, but often without seeming infected, have been identified for human intestinal pathogenic E. coli. They include many farm animals, like cattle and poultry. Companion animals have had the bacteria as well. The bacteria resides in their intestinal tracts, and some strains are benign, while others are dangerous. There is evidence that this bacteria transmits from animals to people. Antimicrobials, or agents that stop the growth of microorganisms, are often used in livestock production. Antimicrobial resistance is increasing, making infections harder to treat. According to an article by the New York Times, officials identified a source of contaminated romaine lettuce with E. coli bacteria to a tainted irrigation canal in an Arizona farm. The Federal Food and Drug Administration connected the genetic makeup of the E. coli with the bacteria found in the area's farm water. 5 people died from the outbreak from several different states, and over 200 others were ill in 36 states. This is not the first time that an outbreak has happened on such a large scale of E. coli. Like the 2006 outbreak of nearly 200 people from tainted spinach, sourced from the same California produce company. People who got sick still have a risk of other illnesses, such as kidney failure.